Use an antiseptic swab to clean the site, beginning at the center and circling outward about 2 inches or 5 centimeters. Remove the cap and hold the syringe between the thumb and forefinger of your dominant hand, with the bevel of the needle pointing up. Stretch the skin taut at the injection site by pulling gently with the thumb and forefinger of your non-dominant hand. Hold the needle very close to the patient's skin. Insert it slowly at a 5 to 15 degree angle until you feel resistance. Advance the needle through the epidermis to a depth of about 1/8 of an inch or 3 millimeters. After withdrawing the needle, gently wipe the site with an alcohol swab or gauze pad. Do not massage the area.
Just take your needle and insert it. I like to insert it more on the mesial, towards the mesial of that canine to aim for that foramen that's right there. You'll insert. And then you'll aspirate and deposit your solution. This one takes about 1/4 of a carp.
So today the first injection we're going to be giving is an intradermal test, an ID.
Okay. So the first thing I'm gonna do is clean the area. I'm gonna pull the skin tight. I'm gonna insert the needle at a 10-degree angle. I'm gonna slowly push in, administer the medication. And it's gonna become a wheel.
When she's administered her full amount of medication, she'll slowly take the needle out, put the safety on, and dispose of her needle.
Okay, and once we get out there in the field, you don't want to be doing all these measurement things because people get nervous, okay? So yes, there's your center right there. You're gonna grab that, you're gonna clean.
We have 2 hours.
Okay, from the center, work your way out, snail shell.
Make sure this is
Good.
in the area.
Okay, and you don't want to come back across what you just cleaned. So center, work your way out, and you're done. Okay, there you go.
I don't think there's a big like that.
Now you're gonna hold it. Okay. Okay. You're gonna hold it just like this.
Okay.
Okay. And your bevel is up. That opening, the bevel is up, and then with this hand, you're gonna hold this tight. And make sure you don't go into that vein. See that vein right there? Okay. So you're gonna go, 10-degree angle, just under the first layer. There you go, and keep it right there. Come around with your left hand, and don't move this hand around. Hold it nice and tight, and then push it in. And keep that hand steady. There you go.
Right?
Keep it steady. Keep going.
That's bad.
You're watching, making sure that you have all the medication in. Beautiful. Okay, and then drop back.
Watch out.
Okay.
A 25 gauge needle is used. The area of insertion is height of mucobuccal fold above maxillary second molar. The orientation of bevel is towards the bone. Now you ask the patient to partially open the mouth, pulling the mandible to the side of injection. Retract the patient's labial mucosa and pull the tissue at the injection site. Insert the needle into the height of mucobuccal fold over the second molar and advance the needle slowly in upward, inward and backward direction. Aspirate in two planes. Rotate the needle bevel and then re-aspirate. If both are negative, then slowly deposit 0.8 to 1.8 ml of local anesthetic solution.
Pull the skin.
So you're gonna wanna put your thumb up here and pull so that your thumb's out of the way. Okay. And then bubbles up. There it is. Okay, go ahead.
Ready?
Okay, go ahead. And you're gonna go right about here because you're gonna go in between those two veins. There you go. Don't let it go. Don't let it go.
Oh,
Hold on to it. Hold on. Hold on. Hold on. There you go. Okay, and inject. Left hand out of the way. There you go. And drop it.
So first, we are about to prepare the tissue at the site of injection. So first is we clean with a sterile dry gauze. We have to dry this part so then the topical solutions would be absorbed rapidly. We use a cotton swab to apply the topical antiseptic at the part to be injected. So we wait for a few seconds for the antiseptic to be absorbed. We do not want to let the area to get wet again. For the next topical is we are about to apply the anesthetic. Then we wait for 1 minute. So we orient the needle so the bevel faces the bone. As you can see, there is a black marker which indicates where the bevel is located for easier indication. We place this and then we orient this needle which faces the bone here. So we lift the lip, pulling the tissue taut. Hold the syringe parallel to the long axis of the tooth. We insert this 27-gauge short needle into the height of the mucobuccal fold over the target of the target tooth. We advance the needle until the bevel is at or above the apical region of the tooth. Then we aspirate, and if it is negative, we deposit approximately 0.6 ml or 1/3 of the cartridge slowly for over 20 seconds. We do it slowly so then the tissue won't be causing any balloon. And then we slowly withdraw the syringe and make the needle safe using a scoop technique. And then we wait for 3 to 5 minutes before starting the procedure.
Okay. So pull the skin tight, it's out of the way.
For a right or left ASA nerve block, the right-handed operator should sit at the 10 o'clock position facing in the same direction as the patient. The infraorbital foramen is palpated and the lip is retracted. A 25 gauge long needle is inserted into the height of the buccal fold adjacent to the maxillary first premolar. The needle is held parallel to the maxillary bone and inserted until bone is contacted at the roof of the infraorbital foramen. After 2 negative aspirations, 1/2 to 2/3 of a cartridge of local anesthetic is deposited over 30 to 40 seconds.
Over toward me, please. Thank you. Close just a teeny bit now. This one could pinch just a little bit more in the front. Okay, I'm going to switch anesthetics. I'll give you a little bit more, then we'll give you a rinse, and we're going to let you get numb.
I got spit right now.
Actually, let's just do it in a second.